This is Dr. Meyer, practicing pulmonologist in Sacramento, California. And today I'd like to talk about a very important subject on how to choose your personal physician. This is a very important subject that is frequently poorly understood, and once you find a good doctor, be sure to stick with him and don't ever get sick without one, because the life you save could be your own. And when you find one that you trust, then every time he sends you for a consultation for another test, be sure to check with him before you see the other doctor, so you get some perspective on what to expect and what may happen. Let me tell you about a Mr. Bacon who had some bloating and discomfort in his stomach, and friends suggested he see a surgeon, sounding like gallbladder disease, and so they went to a surgeon, and the gallbladder wasn't working. There weren't any stones in the gallbladder, so the surgeon suspected they had a cancer at the head of the gallbladder, and so he went in to do what is frequently called a Whipple procedure. This is a very devastating operation because you not only have to get the head of the pancreas where the cancer is set, but you could get out the gallbladder, part of the stomach, part of the bowel, and you have to put this all back together. Cancer of the pancreas is one of the most fierce ones we have, and there's only about a 5% chance of surviving it. Well, this man, the surgeon went in, and this man didn't have a cancer. He couldn't find it after digging through all the areas there, but he went ahead and completed the Whipple and took out the head of the pancreas, the gallbladder, and that it wasn't functioning. And the man had one complication after another. He had 3 operations before he finally left the hospital after about 6 months of operations and intensive nursing care, and he survived primarily because his wife was there every day attending to his personal needs. After it was all over with, his wife came in and was crying because she had not really checked with her own doctor what might be happening, and that maybe all this could have been avoided. And the personal physician probably would have put it in perspective that let's wait a few days and see what it is. And she says, you know, he really wasn't doing all that badly. In fact, he was putzing around in his garage listening to tapes and CDs and so on the day before surgery. And of course, he will never do that again, and is spending the last 3 years of his life in a convalescent hospital. The point not to be missed is going back to your personal physician helps put things in perspective, and frequently a period of watchful waiting will help put things in perspective even for the patient. The life you save is certainly your own, and furthermore, in these cost times, Medicare would have saved $800,000 on this particular patient. That's it for this week, and tune in again for more information next time.